If you've been trying to conceive naturally but aren't seeing results, or you've faced failed IVF transfers, poor egg quality, diminished ovarian reserve without clear answers, or maybe you kept dealing with unexplained infections or pregnancy losses, today we're uncovering the hidden role of ureaplasma, a silent infection that might be sabotaging your fertility. At the end of the episode, you should know who should get tested and why it matters, how ureaplasma impacts natural conception, egg retrieval, embryo transfer, and the protocols that will give you the best chance for success. Excited for you to listen? Let's go. Welcome back. I'm Sarah Clark, founder of Fab Fertile. For over a decade, my team and I have helped hundreds of couples improve their chances of pregnancy success, whether naturally or through IVF. We specialize in supporting those with low AMH, high FSH, diminished ovarian reserve, premature ovarian insufficiency, and recurrent pregnancy loss through functional testing and personalized fertility strategies. Today, we're digging into ureaplasma and how this can be a hidden factor for failed IVF transfers, egg quality, and diminished ovarian reserve. This episode is for you if you've been struggling to conceive naturally despite doing all the right things. You've had failed IVF transfers, poor egg quality, diminished ovarian reserve without clear answers, and you've experienced recurrent infections or unexplained pregnancy losses. Thanks so much for listening. I'm so thankful that you're here. Make sure you hit subscribe or follow. And if you know someone else who's on the fertility journey, please share this podcast with them. Let's get into the episode. We're talking all about ureaplasma. So it's a bacteria from the Mycoplasma family, and it's often asymptomatic. There can be some symptoms to look at. They lack a cell wall, so making it harder to detect and resistant to many antibiotics. So ureaplasma can disrupt the vaginal microbiome, impair sperm and egg quality, increase inflammation, and interfere with implantation. So who should get tested? So those that are trying to conceive for 12 months or more without success, unexplained infertility, which is a lazy person's diagnosis. That's not a diagnosis. We've got to dig deeper with functional medicine and functional nutrition. There's a lot of things we can do for unexplained, but definitely don't take that as a diagnosis. If you've got a history of recurrent early pregnancy loss or miscarriage, especially after a confirmed heartbeat, you've got persistent bacterial vaginosis, yeast infections, frequent UTIs despite treatment, you've got a suspected endometriosis or pelvic inflammatory disease. You've got elevated systemic or local inflammation. So you've got a positive ANA, your CRP or your high sensitivity C-reactive protein is elevated, so more than one. So you've had a male partner with prior sexually transmitted infections. Your current partner has poor semen parameters or chronic prostatitis. And so for people that have gone through IVF, so poor egg quality or low ovarian reserve or an unexplained cause, failed egg retrievals or a very low yield in previous cycles, failed embryo transfers, so implantation transfers, even when the embryos are chromosomally normal, so they're PGTA tested, recurrent chemical pregnancies or early miscarriages post-transfer, a presence of abnormal embryos repeatedly, without clear genetic cause. History of recurrent vaginal infections during IVF cycle monitoring, elevated urine or cervical inflammation noted during your fertility workup. So that's a lot of things here. We will do a vaginal microbiome test, which looks for ureaplasma with anyone on the fertility journey. We do your gut microbiome, and then we do the vaginal microbiome, and sometimes we can do the seminal microbiome. This is routinely missed in conventional medicine. You're spending tens and thousands of dollars and you're having some of those results, and this could be why. And you don't need to have the symptoms. You don't need to have the UTIs and the bacterial vaginosis. You can have some of those outcomes. So it's extremely important to take your health in your own hands, be your own advocate. If they won't do the test, you got to work with a team that understands this piece. It's not about you spending more money on IVF when not uncovering all these pieces. And I can't tell you the number of people that we see that ureaplasma was not caught by their REI doctor. We do the testing, they have it because they didn't have any symptoms. And that could be why all the failed things didn't work out beforehand. Some key parameters to consider. So if you're trying for more than 12 months without pregnancy success, you've had 2 or more failed IVF transfers, you've had recurrent pregnancy loss, especially 2 after fetal heartbeat on confirmation, you've got chronic vaginal or urinary symptoms. We see this so much, right? Something's going on with your body, but you're like, wait a minute, is it tied in? Yes, your whole body is tied in, and anything going on in your body, from the acne on your face to the digestive symptoms, all impact your egg quality. And then if you had a partner with a history of genital infections or abnormal semen analysis, we've got to dig into this because we got to look at it for both of you. Testing is key. From a conventional side of things, they're going to do a vaginal or a cervical swab, so PCR if symptomatic. Many times you're not symptomatic. In the functional approach, so we'll do a vaginal swab, we like GenoBio, so it's a microbiome panel. We do the gut microbiome first, then we do the vaginal microbiome. So we work on the gut microbiome, that cleans up the vaginal microbiome. We don't just do the vaginal microbiome and we got a whole parasite and bacterial infection. We chase this thing around a circle. So it is a multifactorial approach, but in a short period of time, you can make massive change with your health. From a conventional standpoint, it's often dismissed. They don't even look at this. Whereas we look at it as it's viewed as an opportunistic pathogen that can disrupt the endometrium, the cervix, and the microbiome. If they find it, you may do a single antibiotic. We can do some biofilm disruptors, see what's underneath. Again, we do the gut microbiome and the vaginal microbiome. Sometimes we can do antimicrobial. So it would be, for each person, it's going to be different. The partner in conventional medicine is not always tested or treated. And the functional side of things and Fab Fertile method, it's always tested and treated simultaneously. Otherwise, you just chase this thing around in a circle. It's based on symptom resolution. Here is based on the vaginal ecosystem and inflammation resolution. We are going to be retesting this to make sure that things are gone. So it may be silent or present if there's recurrent implantation failure, early pregnancy loss, you've got that chronic BV, yeast, or UTIs, vaginal irritation or discharge, pain with intercourse, subclinical inflammation, so you've got that elevated ANA or CRP. So some studies here to talk about ureaplasma was significantly more prevalent in patients with failed IVF transfers, 42% than those that achieved live birth. So ureaplasma was present in 16.5% of miscarriage cases versus 17.3% of ongoing pregnancies. A natural conception study in 2023, elevated ureaplasma in the endometrium was linked to miscarriage even when embryos were chromosomally. Male partners with ureaplasma have poor semen parameters, but clearing the infection improved overall fertility chances. So you want to do this before, so I've talked about this a lot. You got to do this before you go run an IVF. So before retrieval, infection can elevate the cytokines and impacting the ovarian environment, leading to poor quality eggs. You got to work on your health beforehand. Before the transfer. So we want to make the endometrium more receptive. So the ureaplasma, it's related with inflammation that can prevent implantation even when you have those beautiful embryos. They're there, but you've got inflammation. The host, you, is not ready. You and your partner. We look at the seminal microbiome too, because you're having intercourse. You have this embryo, he's fine. He doesn't need to work on his health. If he's had an infection, that's causing inflammation after intercourse, and that could be why the embryo's not making it. It is to be able to address these things and giving protocol, like we said, talked about the gut microbiome and the vaginal microbiome. We got to look at the mineral imbalance and then looking at all those markers. So your vitamin D, your high sensitivity C-reactive protein, your homocysteine, your ANA levels, like all that is elevated. There's inflammation. That could be why implantation failure, transfer not working, pregnancy loss. This stuff is heartbreaking. All right. I just went through a whole bunch of clinical stuff, but we've got to look at the mindset, get support on this, have someone guide you through it, right? I see it over and over again where people have spent tens of thousands of dollars, but just because your doctor's not going to know this for the next 20 years, because they say the research is not out now and they don't want to look for it, the research is here now. They're just following an old script and they're using medication and surgeries. So we need to arm ourselves with education. If they don't want to listen, get a new doctor. Too bad. You're hiring them. And so sometimes the antibiotics alone can fail because of the biofilm shedding, and then there's more dysbiosis underneath when we do a retest. We've got to repair and rebuild the vaginal microbiome, get all the good bacteria in there. So you want to prevent a reoccurrence and support a receptive uterine lining. Basically, everything we're doing is lowering inflammation. Definitely check out the episode I did all on inflammation and supporting your immune system. So we've had many people that have had failed IVFs and found out they had ureaplasma and addressed that and went on to have successful transfers. So it's being able to take your health into your own hands here and work on the health of the vaginal microbiome and not just keep doing the same thing over and over again, expecting different results. We need to dig deeper and be your own advocate, which is a good thing. There's things you can do. Just be careful if you feel like you want to do it all in a big crazy rush. Each day we make small changes. We look at your diet, address gut infections, do this in a personalized manner using genetic testing as part of our FabFertile method. Then we look at the gut microbiome. We can bring in the hair tissue mineral analysis, looking at your nutrient levels, looking at your adrenals, supporting you. It's not just all about baby making. We have love making, really enjoying our partner, and then looking at his health too, addressing the ureaplasma with him. So first we got to know what's there. And because we're just told, sorry, bad luck, it didn't work. And you're devastated. It was your last embryo and this was missed. And if you're here, there's a reason. So there's things that you can do. So it's key to go beyond just clearing the infection. You've got to rebuild the microbiome, optimize the vaginal microbiome. I've done many episodes on the vaginal microbiome. So to have a successful retrieval, transfer, or natural pregnancy. So if you want to get my eyes on your specific situation, send me a message at hello@fabfertile.ca, subject line fertile, and we can talk about options to help. Take care.